Hello, I am Dr. Ahilasamy from Chennai. I am going to show a case of left maxillary fungal ball with left congo bullosa. I am doing a mini FESS under local anesthesia and partial middle terminectomy. This is a 35-year-old female patient with a chronic cough. So first step is to pack the nasal cavity to get a good decongestion and analgesic effect with a pack soaked in 4% lignocaine and adrenaline in the ratio of 1:1. Patients are taken under moderate sedation and they are very cooperative with remifentanil and propofol or dexmedetomidine and fentanyl. And now I am giving the spinapaletin block with the 23 gauge spinal needle, which the tip has been bent for around 1 centimeter, and with a solution of 0.5% ropivacaine and adrenaline in the ratio of 1:50,000. That is 20 ml of ropivacaine 0.5% and 15 drops of adrenaline. Of course, I reduce the adrenaline drops if it is a cardiac patient. So after giving this anti-ethmoidal nerve block also, I am resecting the lower half of the middle turbinate. You can do a congoplasty also. Of course, I need to have a post-operative vigilance of the big MMA which I create, being a fungal case. Appreciate the field quality under local anesthesia, hardly any bleeding. Please watch these videos in a big screen or on laptops or computers. Do not watch on mobile itself or pair the mobile with the big TV screen to appreciate the field quality. So the resected lower half of the middle turbinate is there, and the posterior attachment I am gently resecting and have a small attachment, otherwise it will slip because of the patient is kept in 30-degree head up position. So I removed only the one half came, the other half I am removing off with a twist and a pull. Of course, you can cut up to the posterior end. Sometimes it may slip in the room. So it's a cut, slight bleeding because of the septal branch of the spinopalatin artery comes that way. Now I am doing the mini FESS with Nagashima's backbiting forceps. It's an edited video. So the maxillary sinus has been opened. That's the MMA. You can see I had to open very widely, being a fungal case. Now I am using the true cutting forceps or true biting forceps to widen the posterior lip of that MMA. More widening the anterior part of the MMA with the backbiting forceps. Again, appreciate the field quality. Now the fungus is coming into the view, which is in the floor. This patient I have been prepared. They came urgently, so pre-operatively I didn't give itraconazole and prednisolone. So the fungus would not have melted. It will be quite hard. So I had a little bit struggle to remove the fungal ball. Otherwise, I always give pre-operatively itraconazole 100 milligram twice a day and Visolone or the prednisolone 10 mg twice a day. Just dislocating the fungal. Now with the 70-degree telescope, you can have a good look at the fungal which is on the floor. This is a Stowe's Spice camera, and the telescopes are I use or Spice Stowe's for surgery. The fungal ball is a bit rock hard since I haven't used preoperative itraconazole and Bisolone. So trying to remove it in one bulk couldn't. So I had to go to plan B to widen the MMA still bigger. A bit of struggle here because the fungal ball is still rock hard. It is not suckable. So with the shaver, I am widening the middle metal androstomy opening, taking more part of the uncinate. Of course, still it is a mini FESS because I will not remove the upper one third of the or upper half of the uncinate. I am using a Somat debrider system to take out the or widen the MMA. You can use the any shaver system of your whatever you have, or you can use a Chinese or Korean with a Somat compatible blade, or Indian make also. Now I am using the malleable suction curette to dislodge all the fungal material from anterior part and the floor. Now I have got it to the posterior part of the maxillary sinus. Remember, I am working with a 70-degree telescope and hardly any bleeding. Field is very clear. And we operate as daycare in the morning and discharge the patient in the evening. We do not pack the nasal cavity after any nasal or septal surgeries and sinus surgeries also. So bit by bit, the fungal ball is now easily removable. Again, to remember, it is done under local anesthesia and the patient is very cooperative. So now you can appreciate all the fungal materials has been removed, and you can see the cobblestone appearance of the maxillary sinus, which will subside because the fungal element has been removed. Now we switch to the 0-degree telescope. Hardly any bleeding, and we do not pack the nasal cavity and discharge the patient on the same day. But of course, from the second post-operative onwards, we are awesome to do nasal douches. Thank you for watching. See you in another beautiful video soon. You can contact me at the above address anytime. Thank you. Bye bye.